Hello and welcome to part 1 of urinary system pathology. We are going to begin this lecture by reviewing some terms that I'd like you to know. The first is oliguria, and oliguria refers to a diminished amount of urine excretion in relation to fluid intake. So in other words, the patient is drinking the normal amounts of fluids, but the kidneys are having diminished urine output. Polyuria refers to excess urine excretion, and this is a common symptom of diabetes, so something to watch out for if you're urinating more than normal. Anuria refers to the complete cessation or stoppage of urinary secretion by the kidneys, and certainly that's concerning because the kidneys are still filtering waste out of the blood, but they're not able to release anything, so that is a concern. Next, we have cystitis, and that refers to an infection of the bladder or the urinary tract. Uremia refers to increased waste products in the urine, such as nitrogens, proteins, amino acids, and that can be a sign of renal failure. So again, very concerning. Hematuria, we already know that's blood in the urine. Remember, it can be gross hematuria where the patient can see it, or microscopic where it's only detected in lab. Now, there might be some reasons or some indications or some symptoms of why we would want to image the urinary system. The most common indications for imaging of the kidneys and the bladder includes pain. Now remember, the kidneys are retroperitoneal organs, so patients often report they're having flank pain or back pain. So be sure to ask which side hurts, right or left, because that will help indicate if it's the right or left kidney. Hematuria, again, blood in the urine. That's a common indication of something going awry in the urinary system. We'd certainly want to ask if it's gross or microscopic. The frequency of urination. Again, we know that increased urination can be a sign of diabetes. Decreased urination is a sign that something's not functioning properly in the kidneys. Chronic urinary tract infections. Again, we might want to evaluate the urinary system radiographically to see if there's any abnormalities. BPH, that stands for benign prostatic hyperplasia, and basically that is just an enlarged prostate. And then lastly, incontinence, and remember that refers to the involuntary release of urine from the bladder. Certainly that is more common as we age and our muscles kind of atrophy or weaken, but incontinence in a younger person can be concerning, and we'd want to check that out. So let's begin. This is an example of an IVU, an intravenous urogram, and we're going to learn about these in lab. This is an exam where we administer contrast into the bloodstream, and then we take pictures of the kidneys and the bladder. So just to identify the anatomy here real quickly, you can see here is the right kidney and the right ureter. And then of course here is the left kidney and the left ureter. So number 1 again is pointing to the left ureter. Number 2 is the lower pole of the left kidney. Number 3 is a major calyx. Number 4 is a minor calyx. Number 5 is a renal pyramid. Number 6 is the left renal pelvis. And then number 7, of course, is the upper pole of the left kidney. Okay, let's begin with our pathologies. So the first pathology I'd like you to be familiar with is glomerulonephritis. And this is also known as Bright's disease. This is an inflammation of the capillary loops of the glomeruli of the kidneys. So remember, think about your diagram. The glomeruli is this little ball of capillaries inside Bowman's capsule. And that little ball of capillaries can become inflamed. So if this is an acute condition, so it just started, it's fresh and new, this can actually cause the kidneys to become enlarged or swell a little bit. However, glomerulonephritis can also be a chronic condition. And if it's chronic, you'll tend to see the kidneys shrink a little bit. So you'd see smaller than normal kidneys. So please just know that glomerulonephritis is also known as Bright's disease, and it's an inflammation of the glomeruli. Okay, pyelonephritis. Pyelonephritis is an inflammation of the kidney and renal pelvis caused by a pus-forming bacteria. So, pyelo referring to renal pelvis, just so you know. Okay, so the inflammation process during pyelonephritis affects the tissue between the tubules. And remember, think about your diagram of a nephron. Those collecting tubules, in pyelonephritis, you have inflammation around those tubules. Remember, glomerulonephritis involves inflammation of the glomeruli. So, please just know the definition for pyelonephritis. If this is a new or acute condition, imaging may look completely normal. But if this has been going on for some time, more of a chronic condition, you might see some changes in the kidney if you image, some thinning of the renal parenchyma, maybe some blunted or rounded calyces within the kidney as well. Okay, next, hydronephrosis. Hydronephrosis is the expansion or the distension of the renal pelvis and calyces of the kidneys that results from some type of obstruction of the ureters or the renal pelvis. And let's pause for a second and look at it on our CT scan. So this is an axial slice taken through the abdomen. You can see here is the right kidney, here is the left kidney, and they look white because the patient has been given IV contrast. You can see this big ball of gray right here. This is fluid, urine, that is blocked or being prevented from escaping the kidneys and passing down the ureter. So the condition of that distension is called hydronephrosis. Okay, so all of this fluid should be able to pass normally down the ureters. So it may be present in both kidneys, as we see here. It can be unilateral. Also, when females are pregnant, the ureters can be compressed by the fetus. That can cause hydronephrosis. Other more common causes are renal calculi in the renal pelvis or the ureter, maybe a kidney tumor, or other abnormalities. So if a patient has hydronephrosis, the worry is what's causing the hydronephrosis. Okay? All right, next, staghorn calculus. This is a large stone that grows and fills the renal pelvis completely, which then blocks the flow of urine. So again, if our patient's having reduced urine output, we'd want to know why, what's causing that. So if you look at this x-ray, you can see here the right kidney. All of this white stuff is a huge kidney stone. And you can see there's some on the left as well. That is not contrast, that is all kidney stone. Staghorn calculi are commonly associated with chronic UTIs or urinary tract infections. My assumption is they would use a laser to break these up called lithotripsy and then remove them. All right, kind of cool. So let's talk about some congenital abnormalities or anomalies of the kidneys. And remember, when we say congenital, that means that they were inherited or present at birth, typically. So first would be duplicating ureters. The condition of duplicating ureters is when the patient has two ureters or two renal pelvises originating from the same kidney. This is the most common type of congenital anomaly of the urinary system, and it usually causes no health concerns. The kidney still functions normally with no problems. We can certainly do an IVU, a CT, an ultrasound to help confirm these findings. So when you look at this x-ray, can you identify which side, right or left, has a duplicating collecting system? Hopefully you said the left. Here is one ureter, and here's the second. So, kind of cool. The next is an ectopic kidney. An ectopic kidney is a normal kidney that fails to ascend into the abdomen, but rather remains in the pelvis. So if we look at this CT scan here, this is a coronal slice taken during an abdomen pelvis CT scan. And here is your right kidney, and then here is the left kidney. You can see it's down in the pelvis rather than in the abdomen. Now, this type of kidney has a shorter than normal ureter, which you can imagine. Although this condition doesn't pose any health concerns for the patient, everything still functions normally, it certainly could interfere with the birthing process in female patients. We could do an IVU, a CT scan, or an ultrasound to demonstrate this condition. Next, horseshoe kidney. A horseshoe kidney occurs as a fusion of the kidneys during the development of the fetus. Almost 95% of cases involve fusion of the lower poles of the kidneys, which you can see here. And you can also see that here in our IVU. Here's the right kidney, here's the left, and their lower poles are connected. And it's kind of difficult to see because the spine is obscuring our view. This fusion of the lower poles usually doesn't affect the functions of the kidneys. They still function normally. But because of the fusion of the lower poles, the kidneys tend not to ascend into their normal position in the abdomen, and they're typically found a little bit lower in the abdomen or upper pelvis. CT and ultrasound of the abdomen would certainly demonstrate this condition, as well as an IVU. And again, this is a congenital condition that the patient is born with. All right, we're going to pause part 1 here. We'll pick up part 2 with some additional pathologies.